Hello, all. Thanks for joining us. As you can tell, I turned on the recording, so we are being recorded, just so you know, and they will be posted. But welcome to breakout number 2. I think we might have one more person or two. Let's see here. I think Amber is supposed to be joining us as well. But why don't we get started? So my name is Michael, again, just to remind you, and I'm going to be your facilitator for today. My main tasks were to make sure that we were recording. And then we have 3 questions that we want to walk you through. I mean, the big takeaway is we want to hear from you what your impressions are from the 9 key themes. Like, did we get it? Or was there anything that we missed and kind of what stood out from you? So we'll just kind of walk through those. You are welcome to share your comments verbally. If you prefer chat, you can also use the chat, and I will do my best to bounce back and forth and try to monitor comments that way. And I'm just going to scribble some notes on paper because I'm going to be asked to give high-level report back when we get back to the room. Does that sound good? Okay. And I do have the slides also on my computer. So if at some point it would be helpful for you all for me to pull them back up and screen share, I'm happy to do that as well. You just tell me which ones you want to land on, and I'm happy to do that. Sound good?
Sounds good, thanks.
Okay. So the first question really is, what are your initial impressions of the key themes? You know, did we capture it? Or is there anything that we missed? Hi, Amber. We're just getting started.
I'm happy to go first, if that's okay with folks. I think my initial impressions going over this, I think it's a really impressive work, feels comprehensive in identifying the themes. I think some of the questions that I have are a little more detail oriented. And so I think after kind of understanding how the process works a little bit more, I think that's probably more appropriate for the report. But I think overall, I really liked it. I think I really appreciated some of the issues raised too in the presentation around getting clarification and sussing out some of the payment issues. I appreciated the way workforce issues were addressed and how that relates to accessibility. And then also looking at the inclusion of both qualitative and quantitative data in assessing outcomes. So those are some of the first things that came to mind for me.
Okay. Thank you. So we're just doing general impressions from the key themes presented, and like, did we capture them? Did they resonate with you?
Hi, this is Jan.
Oh, thanks,
One
Jan.
of the things that I noticed as I reviewed it was a lack of standardization across the state in terms of data collection, how everybody operates their programs. There seemed to be, there was some consistency, but not a lot across the state. So comparisons could be done, kind of comparing apples to apples.
Yeah, that's a good point. Thank you. So then just to make sure I captured that, just the lack of standardization across the state kind of stood out to you, in particular, how data is either captured or reported, how programs are delivered. So it makes it hard to draw comparisons across the state. Is that?
Yes.
Okay, perfect.
Yes.
The key theme, my impression, I'm Michael, he, him. My impressions of the key themes along, I'll kind of echo what Catherine stated, quantitative and qualitative response and the efficacy of it. Work for the billing protocol kind of, I'm hearing rural, I keep hearing the word rural, but I'm not hearing the word urban. The reason that's important is because the billing protocol, as it stands and how that is concrete, in this model is going to directly affect the quality of the response, and it is directly going to it'll determine whether the quality of care is top heavy in certain regions by who's available to provide the care. So just because there's an availability of care doesn't mean it's going to be absolutely quality. And that's going to vary from region to region, beyond who has the ability and who's covering the costs and where that lands, right? So I know that I'll be really quick. We heard somebody share their story today.
Mhm.
That story could be identical. Somebody else could have that same story, but instead of having a response that they encountered, and it went through different, the quality was different in each of her instances that she shared. There's going to be some regions that there's not going to be any response at all in that experience. So what is that going to look like in this model? Is the response going to be uniform, or a chance for it to be uniform, or is it going to be different? And so I think that the building protocol and who provides that care is going to be critical.
So would it, if I summarize it as, you know, is a concern, or there's a question around how the billing model is going to drive both availability and quality of
Yes.
services?
Yeah, it's gonna-
depending on geography. Is that?
Yes, quality as opposed to, I believe there's going to be care. I don't know if the quality is going to be uniform.
Honey, step back a little.
If you're not speaking, can you put yourself on
Honey,
mute?
her foot is hooked
there's some-
under my car.
Background.
Honey, I can't pull her foot out. You gotta step back with her.
Jan, can you put yourself on mute?
Giving instructions. Margaret,
I don't want to be in her business.
I know. Jan, I don't think you can, I don't think I can mute. Can I mute?
honey, it's foot under my car.
I could, I muted, sorry. All right. Sorry.
Okay.
Okay, so it's a concern over billing, driving, quality and availability.
Yeah.
All right. Any other thoughts that people want to share?
Yeah, this is Daria. I'll just say I'm not that I was surprised, but it's a pretty shocking statement on theme 5. There are no systemic standard practices to support the person and family-centered approach within the current crisis system. I mean, that is a pretty devastating fact, the devastating reality to kind of come to terms with for us, and the fact that we're putting folks in, again, not surprising, but you know, I guess just shocking to see it on paper like this. And I think positive that it's not just a select group of folks that are seeing this and understanding this about our system, but the reality that we are putting folks in more restrictive settings rather than putting them in less restrictive settings just because there aren't any other options. We're focused on the most restrictive level of care, and we don't have, because we don't have anything else available. So just, I guess, feeling validated that other people are seeing this as a part of the system, that we're going to be able to work on it and focus on this as one of the themes. So I appreciate number 5.
Robert or Amber, do you want to chime in around kind of your overall impression of the key themes? Did we get it right? Anything that either resonated or surprised you?
So this is Bob. Again, I apologize. I don't have working camera today. Hopefully you can all hear me all right. Not so much on the themes. You know, there's probably different ways you can slice and dice this. I find this seems to be very reasonable. My comment would be that as I'm here representing commercial health plans, everything was oriented towards Medicaid. And I think it'd be helpful to keep in mind that commercial health plans, although, you know, I will admit they traditionally have been resistant to covering some of the services that Medicaid covers, they can be partners in this, and we should look at ways to really welcome commercial health plans into this process rather than excluding them by just talking about Medicaid, Medicaid, Medicaid. You know, at some point, if anyone's interested, I can talk about some of the things we're doing at Premier, but I'm not here representing just Premier. I'm here representing all commercial health plans. I think, there are varying degrees of involvement at this point between the different commercial plans in terms of what they cover for crisis services. But, as Michael was talking about funding, again, commercial health plans are potentially a source of funding for crisis services if they're brought into the fold, so to speak. So I just want to, share that particular observation.
Thanks, Bob. Appreciate it. Sorry, I got your name preference wrong the first time. Amber, anything to add?
No, I don't really have anything to add at the moment. I mean, I don't think sorry, I said this. I'm not sure that anything in there is that shocking in terms of the system. I think it is a reminder of how complex it is and how many different pieces there are and how far we still have to go to do a bunch of these things. I'm hopeful that some of this will get fleshed out more. I mean, they talked a lot about, it's kind of the first bite at the apple of doing the assessment. I think there's a lot of unanswered questions. I think you heard that from the group. There was questions and hands almost immediately on a bunch of different things. So I think, we got a little ways to go, but not sure anything in there totally surprised me.
Can I add one more just tidbit, if I could?
Of course.
Really quick, I think I see the people on the screen and on the committee. In my line of work as a certified peer counselor and peer support specialist, I think that we see, not everybody, I shouldn't say, I hope that we aren't looking at crisis management and addressing crisis, whether it be substance use driven or whether it be mental health, and we're not looking at it through a lens of, oh my God, the family and the parents are gathered in the waiting room, or the parents and the support system has called and everybody's in a rush to get this person. I deal with people that are coming out of the back seats of cars, tents, broken down motorhomes and such, and we have to look at that as a large, when we're talking about crisis intervention and addressing persons in immediate crisis and living in actual living trauma, that these are the persons that we're dealing with. It's not necessarily a 4-2-5 approach, as it were. If we're really, there's a large contingent of persons that are in crisis and in need that are housing insecure and are living and are at present living in crisis. So to keep that in mind and inside of this whole model.
Okay. All right.
Hey, this is Bob. Can I just add something to, to what Michael said? Excuse me. There's obviously a lot of conversation in various places these days about social determinants of health. And I, as you said that, Michael, got me to thinking that we ought to be thinking of crises not just as purely clinical crises, but social determinants of health also can precipitate crisis situations. So maybe something just adding to add to the conversation.
All right. So it sounds like for this first kind of initial impression of the 9 themes, and I'm going to throw this out there and see, and I'm not going to capture everything that's being recorded, so I gotta try to keep up. But if I had to summarize the feedback, it sounds like for the most part, people feel like HMA captured it. Like the 9 themes, they captured pretty well the state of the crisis response system in Washington. And it's what we know is it's complex. There's multiple players involved, and we probably need to dig deeper. A couple things that people liked were that the kind of balancing of quantitative qualitative data. Liked how the workforce issue was kind of raised, and how some of the drivers of some of those limitations or capacity. Some of the things I hear people wanting to hear and understand or think more about are what is the role of commercial health plans in this, and that they could be a partner if brought in earlier. That funding needs to address both availability of services as well as quality of services. So our funding model needs to attend to both availability and quality across rural and urban. And that we need to remember that kind of people and families in crisis come in many different forms, right, in lots of different situations. And so the system needs to be responsive to any number of scenarios, right, and to really understand the drivers of crisis for families. Does that sound like what I capture for the most part? Okay. So the next kind of question is, what are we missing? Is there anything that we missed when you think about the landscape in Washington? Is there something that we didn't cover? We didn't see in the themes.
I don't know, I guess I would say maybe, I don't know, we kind of, I mean, we went through pretty quickly a whole lot of information about the system, and I don't know, it's hard for me to, I guess, think through right at this moment whether we've captured everything. So I guess I would say I'd want a chance to sit down and look and go back through kind of the list that they put together and the themes and other things to really better answer that question. I think the answer is probably yes, just again, given the number of hands that were raised and the number of questions that were asked, that I think there's probably some pieces that are missing.
I agree with Amber, and Catherine said it right off the bat. Where does the compilation come from? And we can believe that it's pretty accurate, but we could really dig in just a tad bit deeper as we go further along.
Where does the what come in? I'm sorry, I didn't catch that.
How deep can we dig a little deeper?
Oh,
Because
okay.
Catherine, when she first shared, yeah, we can always dig a little deeper. How accurate? We know that it's pretty accurate, but we know that there's probably some bases that can be further covered. Persons like, obviously Catherine is probably pretty adept at that sort of thing. So we can take a deeper look down the road.
So I'm looking at theme number 9, the outcomes from the delivery of crisis services. I guess, I am, and also thinking about like Michael's comment on, different folks that are experiencing crisis and folks that are coming into the system, for example, in the back of a cop car who are experiencing a housing crisis, and thinking about like the other wraparound services that are critical when diverting and intervening in crisis, and just like, I think wanting to talk more about that and see more of what we've found there. I mean, I think the elephant in all of the rooms always is housing. And so just like, where does that connect up here? And are we going to get to talk more about those sorts of wraparound supports that are really critical and actually stabilizing and diverting folks successfully for the long term?
Yeah. So the point of like, and those are that, you're saying that conversation, that information was missing from the report, right? The kind of preventative services, wraparound care that might either stabilize people who are coming out of crisis or prevent people from going into crisis in the first place. Yeah.
Beyond the pure like treatment and support that is directly connected. I mean, I could say that all of this is really directly connected to actual behavioral health treatment, but I guess let me get a step removed from that. I don't know if this is making sense, but
yeah, no, I think I understand. It's really those kind of upstream preventative social supports, social services, wraparound services that keep families and people out of crisis or help them stay out of crisis once they're coming out of one, help stabilize them.
Right.
Yeah.
And I guess I'll just also add on a slightly different path, and then it looks like Michael unmuted and wanted to say something related to that. But the other thing that comes up for me in listening to this, and I think back to theme 5, which I'm stuck on, the person-centered approach, is I'm really, in the work that I do, there are a lot of folks with co-occurring disabilities of all sorts, right? We've got folks who might experience substance use. We've got folks who might be experiencing like a traumatic brain injury, a developmental disability, and kind of like, where are they in the system? How are they getting the individualized, specialized, I guess, support that they need? Person-centered, but I think it's important to call out these co-occurring disabilities as well. Okay, I'll be quiet.
Yeah. So are you saying like, where do they show up in the system, or how do they navigate the system, or how are they being served in the system? So more of a look at the system from the perspective of serving people with co-occurring issues.
Yeah.
Okay.
My forte is really, for what I do daily is in theme 7. And so what I know about the population when it comes to mental health and then substance use, and then when we don't see persons in that demographic, don't see in that behavioral health demographic, don't see physical medical care just on a regular basis. They don't see it unless they're involved in the judicial system, and that's where most of the drive. We don't have a model currently in America that addresses substance use disorder or even mental health for those without insurance that isn't driven completely by the judicial or the law enforcement system. So what happens is you have to have a weather report now because there's such a huge change and a huge shift when it comes to the judicial system and how they address substance use disorder. And that's usually what gets people into care that are from certain demographics and certain incomes, right? They don't generally will never get any of those things addressed. And so the weather report is taken by people like myself that are peers out in the community, working in the judicial system for those that are left in the judicial system, and that's even dwindling. At the grassroots level of day shelters, DSHS, and persons that navigate those services and support. So we don't really know, we don't really have a model. And so that's something that's going to be on theme 7 is what is the licensure and requirements for those people that are going to be going eventually, like in my CIT training. I know that some of those people are going to be present at these crisis interventions, at these in these crisis moments of crisis, and how that we deal with them in these episodes that are substance use, with substance use and with mental health, and how do and they're driven by those two things. And how do we have persons out there that aren't representing trauma at first engagement? And so I'm a big theme 7, and how that is critical, and how we can't have people that get help if we don't know how to help them. Because we're at a point that we're here right now. We are here. Part of the big reason why we're here is because 911 and the conduct of certain individuals within that model have hijacked the system and caused more trauma and more harm. And so it's critical that we have peer support specialists, even mental health professionals and clinical professionals that can go out on the ground, tennis shoes, galoshes, rain gear, whatever it takes, in order to have that happen and get first engagement, for people to get inside of the system. Some of that acute crisis and some of that triage crisis, whatever it may be.
Right, thank you.
I think all of the points that have been made have been really, really good. And I've been really in agreement with a lot of this. And to Michael and Daria's points around like addressing specific supports for people with comorbid conditions, and also like looking at the intersection of people experiencing housing insecurity, and then also I loved your point, Michael, around like kind of addressing prevention and ensuring that people aren't continuing to cycle through the crisis system, and how we can coordinate and integrate all of these really important things. And I think something I was also thinking about, I see that culturally responsive services was addressed, and I think maybe the issue here is that it is so dependent perhaps maybe on the location and the service, and so it's not super standard. But I also think and maybe I need to keep processing this and sitting with it a little bit more, but I'm not seeing racial equity centered in some of these themes, and so I kind of wonder if that could fit in somewhere to ensure that the system that we're kind of standing up, it continues to make sure that we're not perpetuating racial inequities across these systems.
Would it be fair to say as well, I mean, I wrote down definitely the racial equity piece was missing, but in some of the conversations I'm hearing, whether it's with housing or the judicial or kind of court system, or, that is there, are you all trying, I'm trying to make sure I capture this. Is it that there's not kind of cross systems, opportunities for cross system partnership is not captured here? Is that what we're saying, or maybe not? That doesn't seem to be landing, so I'll assume no. Okay.
I mean, there could always be more of that, right? So.
Okay.
So yes.
Well, I don't want to put words out in anyone's mouth. I mean, that's not, I'm not a member of the CRIS. I'm supposed to be capturing your words and your thoughts. All right.
It's really, and I agree with Catherine, it's really nobody's fault. It was the only model that we had, right? When it comes to addressing substance use, mental health, and any of those, because we have a segment of the population that is just now beginning to trust that would, we have a segment of the population that when they know 988 is going to be safe, that they still might not call it until they see absolute proof. And in that, they have to make sure certain persons and certain entities aren't present when they do pick up 988, right?
Mm-hmm.
It's a big deal, man. That's why we're here. That's part of the reason why we're here. A large chunk of the reason why we're here. So I think that we have to find equity on purpose. You know what I'm saying? We have to find equity on purpose, because the same person in Redmond, Washington,
Mm-hmm.
with the same model in place is not going to get the same response from a person in downtown Sela in the middle of June when the population is shifted, correct? Right? So I don't know how we, it's going to take some in-depth data to look at. How do we avoid that? I really believe that there can be a hiccup in quality of care. Really, I really see that being an issue. And because of where, what, and there's certain regions that are top heavy, and there's certain pockets within regions that are top heavy, just because of the nature of where they're at.
Can you say more about top heavy for me?
On one side of the floating bridge, for the same price, my quality of care, even if I'm able to afford it, my quality of care on one side of the Evergreen Point floating bridge is going to be different than on the other side. And that isn't even 5 miles. That's what I mean by top heavy. What happens when it's mental health care and mental health triage care, right? Does it stay there? Does it get moved? How do we address that so that it's so that we're sure? Because I just looked on one of those charts. There's no respite model within. There's no crisis care for beds open in King County, in the Seattle area. We don't have any. It's like 0. And I know the one right off of Dearborn in International District is about it, and that doesn't even really count. That's a drop center. So that's what I mean by top heavy.
Okay. All right. So the last question we had is, which, if any of these themes, do you relate to based on your own personal or professional experience, and why? Is there any of the themes that kind of stood out to you that you relate to?
Theme 2. Your most populous county per 100,000 residents for designated crisis responder investigation. It either means it's being mismanaged, not managed at all, or being misidentified by whoever's responding. So that's what I meant by hijacking, because I know that I work I work in Kent, but I know that two of my colleagues on my drug court team work downtown one day a week. And the courthouse is right there on Third Avenue, right in the heart of those that are disenfranchised. And for that to be the number for King County on that page, on page 20, absolutely not. Absolutely not. I could do that much in a week and count that. I could count that many episodes and potential responses in a week.
I think for me, the two that stand out probably like from the NAMI Washington perspective is theme 5 around person, family, and community centered approaches to delivery. And then I also really like theme 9 around evaluation and data collection. And I think that really speaks to continuous improvement as the system gets implemented.
Yeah, I'm in the same boat with Catherine and Nami. Those were the two themes that I was particularly interested in and definitely spoke the most to me. Making sure that folks with disabilities, whatever sorts of disabilities they have that person-centered care that is really directed by them is really, really critical. It's going to meet their needs, not just put them in whatever options might be available, even if it's going to possibly harm and possibly re-traumatize them as well. And then on the outcome of delivery from the crisis services. So I think that, you know, just resonates with a lot of the work that we've been trying to do with implementing the True Blood settlement agreement and the different court-funded diversion programs across the state, and really seeing what's working and not working and what's still needed there. So 5 and 9.
Bob or Amber, does any of these stand out particular to you or that resonate with you?
Well, so I agree with everything that's been said. Probably one of my biggest burns in all of this, which we've all talked about in various ways, is just the absolute lack of adequate services throughout the state. I could just take a map and draw huge circles around places that just have no services or inadequate services. So I'm, really interested in seeing what can be done to, whatever services we're talking about, to put services in place in locations that just don't have them, where people just right now just don't have access to services. For people that have internet connections, which is not everybody, which we have to keep in mind, maybe we need to start thinking about, is there a role for telehealth services?
Okay. Thank you.
No, and it's very hard for me to say one in particular resonates with me or stands out to me. I think part of the role in the governor's office is we need to pay attention to all of these things. And so saying like, oh, well, person-centered or family-centered is really important that's true, but so is like financing of services, and so is consistency, and so is collaboration. That's a really tough question for me to answer. I think I'm really struck by one of the things that seems to go through all of the themes is the lack of consistency. And how are we going to sort of build a system that is both responsive and nimble to what is needed in a particular community, but also create some kind of consistency around the system so that people understand what they're getting and what we have equal access and that we have opportunities and equity in that way. And that seems like one of the things that comes out in all of them, because all of them talk, I think basically every theme talked about some lack of availability or consistency in every single one of them.
Thank you. All right. Okay. Well, that's a really big question, right? That is one. How do you have consistency, stability across, but also have, allow systems or programs to be responsive and adaptive to their communities and their needs. So that's a big tall order. Yeah. So I think we still have about 8 minutes. And so it's really, I mean, this is really, you know, for you all to be able to discuss and lift up these themes. And even if you're kind of thinking about one that's like, I didn't fully quite feel like there's something odd about this one, you're welcome to have just that conversation. You will have between now and November 30th to also submit feedback on these themes still. So if you're also one of those people that needs more time and you want to kind of sit with these and you think of something later, you can submit a written comment or feedback around these themes. It's important because the report that will be drafted, will be written, that kind of more thorough one is going to be really based on all this feedback from you all from these themes. So.
I think one thing I didn't see, and I know it's embedded within the data and within the report, but we can't really look at it as a presumption, and we're talking 13, 14 to let's just say 23 years old in that population. I just believe needs to be served intentionally, and I think it has to be very specific on the support, on the actual support of that age group and their mental health and their well-being. And how do we address that? How do we do it safely? How do they do it without fear of there's that clinical and constructional retribution fear that sits with every adolescent, for even the ones that do reach out. And so what does that look like, and what does that portion of the model look like? How do they get assistance? How do they get services? How do they get inside of care in the model without being traumatized further and without being preyed upon, right? It's no different when we're talking institutionalization. We're not talking just about jails and institutions. We're talking about hospitals, mental health facilities, any of that type of thinking is a breeding ground for preying on the vulnerable, be it with the population that Daria works with, or young persons, or adults with mental illness and mental challenges, whatever. There's always going to be that vulnerability. And so my concern is how do we fit the young adult and adolescent population inside of this model and do it safely.
You know, if I kind of think about that comment and some of the other ones, right, there seems to be a thread of like, you know, this report doesn't necessarily, as it is now, these themes don't tell us how certain populations encounter and make it through the system, whether it's adolescents and young adults. I heard that around people with disabilities. I heard that around people who maybe have comorbidities, right? Or people who are experiencing houselessness, that there is kind of this lens of wanting to understand that our current state of our crisis response systems by certain populations and their experiences. That's kind of why I feel like that's a thread that I'm hearing from folks. See some nods, yeah? Okay. And that might be a really big missing thing.
No, just in the nature of how we are in society right now, even though we have people that are becoming more aware, you could draw a picture of the people that we think that we may be dealing with externally. We just don't have the ability to look outside of that box. I'm forced to, of course, but that isn't everybody's experience, right?
Yeah.
And so I think that's why we can sometimes live on a presumption that we are including everybody, but that's not necessarily always the case. And so we have to be really intentional about those intersections, as some of persons on the screen have said, that intersectionality has got to be on purpose. It's got to be very intentional. And it's got to be hammered home, really. It's got to be hammered home, because we're talking ecosystems within each mental health, substance use disorder. There's different ecosystems depending on each person's background and their trauma. There's ecosystems that they come from, and they're very deliberate and they're very real. So,
yeah, well said. All right. Well, I know we're getting down there on our time. I think we may have a couple more minutes. So if there's any last comments that people want to leave, I'm gonna when we get the 1 minute notice, I'll probably stop recording so that I can say before we exit the breakout room, so we don't lose it. Any last thoughts, comments?
I think the last one I'll just comment on is, and you all have already talked about number 9, but I think that's one where there's a real role for the CRIS to play in thinking about what are the outcomes that we really need to have? What are we going to look to? How do we know 988 is doing what we're hoping it's doing? And some of that isn't, it's the absence of or negative data, right? How do we figure out when people are not coming into crisis? Where are they going? Are they going into supportive and preventive systems? Or are we somehow putting them in, as Michael and others have pointed out, into institutions or into jail or into homelessness or into places where we're just not capturing them? It doesn't mean our system's working. We've just pushed them off into other systems where we aren't keeping track. So I think that outcome piece is going to be so critical to the work going forward.
Thank you. I captured that. Appreciate it. Okay, I'm going to stop recording now. Thank you.